Welcome to Season 1, Episode 8 of the Home Healthcare Today show. I'm your host, Dr. Cleamon Moore. It's National Nurses Month, and this episode we have the honor of having Dr. Gonzalo Gonzalez join our show. Let me tell you a little bit about Dr. Gonzalo Gonzalez. Dr. Gonzalez is an advanced practice provider and medical scientific professional collaborator. He holds that doctorate of nursing practice from the University of Michigan. His doctoral research was focused on pediatric diabetes. He's a certified advanced practice nurse practitioner with 5+ years of professional clinical experience and 3+ years of clinical research experience. He currently operates as the team leader of a division of over 5 infection prevention and control professionals for the Center for Disease Control Foundation in response to COVID-19. He's responsible for infection control oversight, guidance, and safety of large, medium, and small healthcare providing facilities here in Detroit. Dr. Gonzalez, welcome to our show.
Dr. Moore, thank you so much for having me, sir. It's a pleasure to be on here and connect with your audience. And first of all, congrats on this show, and
thank you.
Pleasure speaking with you. I really look forward to the conversation today.
Awesome. Thank you, Gonzalo. So let's just go in a little bit about yourself. For starters, I know that you grew up in Detroit, right? We talked a little bit about that in some of our earlier conversations. But tell us about growing up in Detroit, your expertise, your passion for Detroit, patients and families, and even public health.
Yes, sir. So my father actually grew up in Southwest Detroit, in Mexican town. So I spent a lot of time growing up out there, going to, eating great food out there, and just enjoying Southwest. Mm-hmm. And always just really love the people of Detroit. The people of Detroit have always been, I've embodied, envisioned them as being very resilient. Yes. And strong-minded, and just so diverse. And I started my career at the University of Michigan Hospital, a large academic research hospital, and that's really where I got to develop my love for nursing, my passion for nursing and serving patients. But I always knew I wanted something more, and so I always knew I wanted to go back and serve the people of Detroit in a public health capacity. Yes. And so I pivoted to public health with the City of Detroit Health Department. Yeah. And I've honestly never looked back. It's been a blessing, and I love it because I get to connect with not just a single patient, when I'm in the hospital, yes, but you get to connect with the community. And yes, you get to see, you really get to see, most importantly, Dr. Moore, yes, where your patients are coming from, the communities that they're growing up in, the schools that they're attending, the homes that they're growing up in, mm-hmm, which plays, as you know, such a foundational and has such a profound impact in their upbringing.
It sure does.
And so that experience, coupled with my experience, mm-hmm, in the inpatient side, yes, has been truly a blessing to combine both of those worlds. It makes me more complete clinician, makes me more mm-hmm, complete nurse, yes, and it's made me just a more stronger individual learning their stories. So that's my passion, and like you said, my yes, research, my focus really is in pediatrics, and as well as the diabetes space, and that's something I'm very passionate about, and worked with a large hospital health system here in developing a clinical tool to help transition pediatric patients, yes, from that have type 1 diabetes from pediatric care to adult care.
Yes.
And so we built a tool in their electronic medical record that the providers, the nurses, the nurse practitioners, the PAs can use to track those patients' progression and make sure that they're ready to transition effectively into adult care where it's more hands-off.
Absolutely, absolutely. This is wonderful, wonderful stuff, Gonzalo. And, I feel your passion. I feel the energy, for the youth, being able to relate and connect by growing up on the Southwest side. I grew up not too far from you on the Northwest side. So I thoroughly get that West Side Detroit, And then youth, as you said, the clinical tool that helps to track their clinical progress through adolescence, through adulthood. And let's talk about that a little bit more, Gonzalo.
Absolutely.
As we think about kids, they face obstacles, obstacles in Detroit, right? And we've been able to mitigate a lot of those. We've strengthened our education system, as of late. A lot of more focus from the city of Detroit on parks and youth activity. So we see great stuff happening in the beautiful city of Detroit. As we think about kids, though, let's talk a little bit more about, your path as a kid saying, I want to be a nurse, let alone I want to be a doctorate. I want to get a doctorate degree in nursing. What about kids? Talk about some of those obstacles and challenges you faced, how you overcame them, and then how can we encourage and inspire some of the youth to consider careers in the health field here in Detroit?
I love this question, and when you sent me this question, I was given this one particular lot of thought, and I can honestly say what did it for me, and I come from I'm Mexican American, proud Mexican American, and we're not really represented in STEM.
Sure.
Science, technology, engineering, and medicine.
Yes.
So what did it for me, Dr. Moore, was I had a really passionate high school biology teacher. And she really instilled in me a love of science. That was my freshman year in high school. And I just love learning about the human body. I love learning the science. I'm a science geek.
Okay. Yes.
And so learning as much as I could was just, for me, it was beautiful. And I started learning more about, what could I do with this? Where can I go with a biology degree if I decide to pursue this in college, which I eventually did. And initially, what I wanted to do before becoming a advanced practice nurse was I actually wanted to become a scientist.
Okay.
I actually wanted to potentially pursue a PhD and go into research, but I quickly learned that that wasn't me. I was missing something.
Okay.
And what I was missing was that clinical piece that I later found out. And so let me take a step back and give a shout out to my mother.
Hey. Yes, sir.
My mother is a proud nurse at the University of Michigan Hospital. She's been there for over 30 years, and she works in the neonatal intensive care unit. And she was the one, she was like, why don't you consider a career path in nursing? At first I thought, I said, Mom, I don't know about that. I don't know if that's right for me. But what she told me, and I didn't realize at the time, was you can do anything with that degree.
Anything.
And now I'm learning, I'm 30 years old, going to be 31 here in September. I've learned that this degree has opened up so many doors, Dr. Moore.
Yes.
In terms of you can do so much. You can go into academia, certainly clinical practice, work in public health like I do.
Wonderful.
Work in government, work in the pharmaceutical industry. Really the possibilities are endless.
Yes.
And so what I would say to younger Detroiters out there who may be interested in pursuing a career in science or medicine or nursing or pharmacy or what have you, it only takes just one person. It only takes just one person to really a mentor. You just find that mentor, find somebody who's passionate about what they do, and then that mentor could be your mentor throughout the rest of your life and really kickstart, potentially a bunch of opportunities down the line. You never know.
Absolutely, Gonzalo. And I'm glad to hear you say with that degree, you could do anything. You could take that path in academics. And when it comes to that science teacher that was a great mentor and inspiration for you, your mom being a great, focal point and leader in your life and inspired you, I could see you teaching I can see you teaching at some point since you mentioned academia.
Thank you.
Yep, I can see you teaching some of the youth out there here in Detroit. So you all heard it, kids. Keep loving STEM, love science, dive deep into it. We need you here in the city. The state of Michigan needs you. And healthcare is still one of the fastest growing fields next to,
Absolutely.
Next to technology. Health is the fastest growing. So
Yes,
yes, indeed. So as we think about nursing in the public health space, and we're trying to encourage the youth during National Nurses Month, or not even youth, for some of those frontline workers who are going to take full advantage of the stimulus program at community colleges to return for education.
Absolutely.
What would you say the top 5, or if it's not 5 off the top of your head, maybe 3 or 4, what would be the advantages, Gonzalo, of pursuing a career in public health right here in Detroit?
Absolutely. I love this question too. There are a ton of advantages, and the ones I want to particularly highlight is kind of what we've already, Dr. Moore and I have already been discussing, which is engaging with the community. Public health is a wonderful platform to really get out and engage with the community, engage with patients, meet them where they're coming from, at their see where they're growing up, with the homes that they're being raised in, the communities. That's how you get to really learn more about somebody.
Yep.
It's one thing, like I said, taking care of a patient in the clinical setting. You don't know that story.
Nope.
You might not get that other critical element to their life, their upbringing, which shapes that individual.
Yes.
So really, public health allows you to engage with the community. Number 2, it allows you to collaborate with so many interesting people. I can't tell you how many interesting people I've met in just 3 years of time working here in the city of the wonderful city of Detroit. We work with so many great people, like partners like Dr. Moore here. So many wonderful community agencies doing God's works, truly, that are just incredible. I learned so much from them. I learned so much from my team. My team is, I gotta give a shout out to my team.
There you go.
They are the hardest working people I know on my long-term care facility team. My colleagues from the CDC Foundation that assist the Detroit Health Department, and my other extended Detroit Health Department colleagues and the Aero staff that that the Detroit Health Department has partnered with as well. Mm-hmm. And then we also, because we're blessed here in the city, as you know, Dr. Moore, we have a number of world-renowned academic medical centers.
Yes, we do.
PMC, Henry Ford, Beaumont. We are absolutely blessed. Wayne State University Medical School, the pharmacy school. Meeting these leaders here has just been I honestly learn something every day, working. And that for me is segueing into the last point, which is lifelong learning.
Yes.
You can learn just an infinite number of things here in public health and with the people, through the people you meet. And I would say really just those 3 things. Those 3 things are my personal passions, and just what I would say to anybody considering maybe working for the health department here in the city of Detroit, working for your local health department if you're in another county or maybe in another state. That's really been a blessing for me, all those 3 things.
Wonderful. Thank you, Gonzalo. I'm going to do a quick recap of that list, for viewers just tuning in prior to our commercial break here. Gonzalo laid out, some very key points for why serving in the public health sector in Detroit is a good idea, right? He mentioned engagement, being able to engage with the community, right? So being connected locally to the individuals, the businesses, the organizations here in the fine city of Detroit. He also talked about collaboration, how great it is to be able to collaborate with an internal team that's very strong and talented, but also external partners. So that ecosystem that Metro Detroit has here in the public health space. He mentioned our world-renowned health facilities and hospitals. So we are home to some of the greatest health institutions in the world, not just the country, but the world. And then being a lifelong learner. right? So we're doing a pitch to recruit talent, whether it's talent that is within our youth ranks or some of those professionals or even seasoned professionals who are thinking about a career change or even a change of residence. Come on down to Wayne County, city of Detroit, and we can do some great things in the public health space. We'll be right back after this commercial break.
Spring is a beautiful time in Detroit and Southeast Michigan. American Advantage Home Care brings that energy, joy, and vitality of the season right into your home, coupled with skilled home health care services. Our world-class team of clinicians can help you to thrive, maintain, and rebound in the comfort of your own home. Finding a home health care agency more compassionate and caring than American Advantage Home Care is a long
All right, once again, thank you for joining us for Season 1, Episode 8 of the Home Healthcare Today Show. It is the pleasure and honor of mine to have Dr. Gonzalo Gonzalez on our set today as we discuss National Nurses Month. So we had some great dialogue and interaction in our first segment, so thanks for coming back for the second one.
Thank you.
A few more questions for you, Gonzalo, since I have your time and attention. We were talking on our commercial break there about our various backgrounds and how when you make that transition from academia to an extent and you're in that public space and you're doing some good work there, you still love your research. And I view Gonzalo here as a public servant, a clinical professional, as well as a scholar in view of the research that he has conducted. Gonzalo, how does that research, how does it translate into practice? And ultimately, how does it have a community impact? If you could provide some examples of that.
Great question, yeah. And to be completely honest with you, when I was going through my doctoral work, I didn't really have a good answer for that because I hadn't done it.
Right.
You hear about it. You hear about your professors, these clinicians doing these research studies, doing these evidence-based practices, putting it. But if you've never really done it, then you don't know. So for me, as I said earlier, my research focus is in pediatric diabetes, type 1 diabetes to be specific, and specifically within that space, what my colleagues at the University of Michigan and our partner, a large academic medical center here in Detroit, were working on was a transition of care model for adolescents with type 1 diabetes and trying to successfully transition them into adult care. So I'm very, very pleased to say that research, that project, that work, that team, it's a team effort. Yes. I want to be very clear there.
Sure.
We were able to implement a transition of care tool within their health record, their electronic medical record, their EMR, where the clinicians are actually using that in their daily practice to this day. Yes. And so, and we've received a lot of support and feedback, not just from the folks who are using it, the clinicians on the ground, but most importantly, and I always go back to this is at the pinnacle, we all serve the patients.
Absolutely.
We all serve the patients and we all serve the families, and they've said that this tool is useful for them to track their progress and how comfortable they feel with making that transition from adolescent care into adulthood, because there's a lot of skills that they need, and this doesn't apply. Let me just be clear: this model doesn't apply just to diabetes. It can apply to any number of chronic diseases. Yes. Whether that's a heart disease or anything you can think of. And so for me, really seeing getting back to what you said, the true joy of that project, that research, is getting the positive feedback from the patients and the families, and that's what did it.
Yes, and that's what we sift through and wade through as professionals, as researchers, as scholars in various fields. How do I go through, the testing, right? How do I go through theory and challenge it? How do I apply it and implement it into some type of tangible tool that improves the lives of others?
Exactly.
And that's what it's about.
You hit the nail on the head.
Yes, sir, Gonzalo. With that being said, since that tool helps not only the pediatric community that suffers from type 1 diabetes, but it has some utility across the field and in other chronic diseases. We serve patients, of various ages who struggle with a number of chronic diseases, Gonzalo. In view of that constituency, the homebound, right? The homebound in Metro Detroit that are sometimes disconnected or at times disadvantaged. Do you think home health care, a home health care service, could be a means to enhance or to extend the realm of public health to some of those disadvantaged and disconnected folks?
100%. And I want to elaborate on this because I think this is so important, is especially here in the city of Detroit, not just the city of Detroit, but elsewhere, communities can really benefit from what I call the home-based model. And I'm very, very proud to say that when I first started with the health department, one of the first program I actually worked with Dr. Moore was the Childhood Lead Poisoning and Prevention Program. Yes. Wonderful program at the health department.
Absolutely.
And I got to give another shout out to the folks that are still doing that hard work. They're a small team, but they are some of the hardest working group of women that I know. Yes. And I just want to say that. And so in this experience, I got to go to patients' homes. Yes. and see the home environment, see the community environment, and I saw firsthand, Dr. Moore,
yes,
the benefit of meeting the patients and families where they're at, not where we're at,
but where they're at.
Yes, sir. And so when we did that, the amount of support and feedback that we got back from our patients,
yes,
the kids that we serve and their families, was nothing but positive.
Wonderful.
They said that they absolutely loved the care that the Detroit Health Department was providing them through the Childhood Lead Poisoning and Prevention Program. And they trusted us. We built such strong trusting relationships with those patients and their families.
Absolutely.
And I'll say this: they trust us so much that I'm backtracking, that they allowed us to come into their home, the most sacred environment, their home, and to help give them education, treatment information, do health assessments, checking in on diet, nutrition, assessing developmental milestones. So that was just such an amazing so back to your question, I know that this model can be so effectively used if done right, and using it like kind of what we did here with the City of Detroit's Health Department Childhood Lead Poisoning Prevention Program.
Yes.
Meeting the patients and families where they're at is such a plus.
Yes, it is.
Such a plus.
Absolutely. Home is where the heart is, and I want to believe at some point home will be where healthcare is best served to an extent. Absolutely. Very good, Gonzalo. All right. Over the last 18 months or so, I have to say the acronym CDC might have, ranked very high in Google, right, in terms of being one of the most searched for and searched after organizations. So speaking for the Center for Disease and Control, are there any resources, any additional resources or programs that you would recommend for viewers and listeners in Southeast Michigan? Or is there anything else you would like to add or discuss?
Absolutely.
Yes.
So would love to connect the audience here with the resources that I use and that I give to my patients and community members, organizations throughout here, the metro area. Number one, as Dr. Moore said, let me just take a step back. You really want to, a lot of people ask me, well, how do you differentiate between a good source of information and maybe a not so good source of information?
Sure.
And so, Dr. Moore, as you know, you really want to, so CDC is gonna be your go-to at the national level, because that they're bringing in what's called peer-reviewed by experts, by medical and scientific experts, and so that information has been studied, it's been fact-checked. And so it's very, very highly accurate. So that's number one. That's what I use, and that's what I give to my patients and community members. Number two is check with your local health department. Yes. Check with the Detroit Health Department. We've got a wonderful website up there. and a number of great resources related to COVID-19, a number of great resources to go get testing, go get your vaccine, which everybody should do. Make sure you get the entire series, keep you and your loved ones safe. So I'd say that, check in with your local health department. And number 3 is go to your primary care physician, go to your provider. Many of you may have a provider that you really trust, so absolutely go to them, go to somebody you know and that you trust to get that accurate medical and scientific information. And then the last thing I'd say is tune into shows like Dr. Morris here, and because he's got a lot of great people, and I honestly was quite daunted. I told him before stepping on, because he had a number of heavy hitters before me. So I would say definitely tune into to his show as well.
Wonderful. Thank you so much, Gonzalo. So do a recap there, folks. If you're looking for additional resources from CDC, definitely visit their website. Peer-reviewed materials that have been vetted from researchers, scientists, scholars from all over the world to continue to advance the knowledge as we know it. The City of Detroit Local Health Department and Wayne County Health Department, seek information there. Your primary care physician, call up your doctor. In the event that you're homebound and don't have a primary care physician, American Advantage Home Care can help you to find a visiting physician or a primary care physician to take good care of you. And then thank you, Gonzalo. Sure, tune in to the Home Healthcare Today show, our bi-weekly webcast and podcast where we cover a vast array of topics that are important to the health community of Metro Detroit. Gonzalo, happy National Nurses Month. It's been a pleasure having you on the show.
It's been a pleasure and honor. Thank you so much, and congrats again on your show. Thanks for having me.
Thank you, sir.